Kenya's public health insurance system just did a full U-turn again. First came fingerprints to authenticate patients' identities. Then came one-time passwords or OTPs. Now, we're back to biometrics. Let's break it down. In 2021, the Ministry of Health introduced biometric verification under the National Health Insurance Fund, that's NHIF. Patients began using fingerprints instead of ID cards to curb fraud and speed up service. But hospitals said, hold up, the rollout was rushed and expensive. Lawsuits followed. Still, the government moved on with it. Turns out, the system was a goldmine for fraudsters. Some hospitals allegedly cooked up NHIF claims and used one fingerprint to file claims for thousands of fake patients. In January of 2024, the then Health Cabinet Secretary Susan Nakumicha said the fraud cost the government at least 20 billion shillings. The Rural and Urban Private Hospitals Association, that's RUFA, rejected these claims. It termed them a ploy to tarnish NHIF's image and possibly make the case for a new public healthcare system. So in 2024, the government scrapped fingerprints for OTP codes under the newly introduced Social Health Insurance Fund, that's SHIF, which was rolled out in October. The government hoped this would seal security loopholes and tame medical claim fraud. Smart, right? Well, not really. It brought with it new issues and carried some from the old NHIF system. So by February of 2025, hospitals said 89% of patient logins were failing. OTPs delayed by up to 24 hours and system outages left patients footing for their bills. Meanwhile, reports of corruption persisted. The health ministry said rogue hospitals were exploiting OTPs by misusing patients' fingerprints to process fictitious claims. There were also reports of phone number manipulation. The health ministry then began hinting at plans to revert to the biometric authentication system, which brings us to this week. Now the government says, let's go back to biometrics. The current health minister, Aden Duale, announced the ditching of OTP verification, citing operational challenges, public feedback, and, well, corruption. This time, the government says biometrics will be used alongside a new app called Practice 360 to help manage the claims. It says fingerprint scanners are linked to a central database to detect fraud in real time. But here's the thing. Going by the failures we saw with OTPs, this new app's efficiency remains to be seen. So does its performance in areas with poor network connectivity. Also, it is not clear how well hospitals are prepared for the rollback, since some facilities abandoned biometric verification equipment nearly a year ago. Dole says this is a clean break from the past, but Kenyans are asking, will this fix the fraud mess or just start another expensive cycle? What do you think? Tell us in the comments below, and remember to stay posted on these and many more stories on www.citizen.digital.